Hey, and welcome back to my channel. I appreciate anybody that's willing to tune in and listen to what I have to say, because frankly, for far too many years, it felt like the things that I had to say were falling on deaf ears, and that led to a significant degree of frustration and angst for me. So the fact that anybody would take a few minutes and just listen to me talk is appreciated. So thanks. So as the title of this video suggests, I'm going to fill in a few more details about the alleged sexual assault that was being investigated at Norton Healthcare. Sometimes I worry that people think that I'm making it up, because I'm sure people have probably tried to give that impression for one reason or another, or that I'm just frankly a little off my rocker. And like I said in an earlier video, maybe I am a little bit, but part of the reason is I'm trying to do the right thing here. So I previously released a tiny little snippet of this particular conversation with who is now a former Norton Healthcare executive, and I know she was terminated sometime around when I released that last audio clip, and frankly, if they did, I've got even more questions, which is the nature of dealing with Norton Healthcare, frankly. So I have just a few little segments of one of those conversations, and want you guys to sort of listen thoughtfully and come to whatever conclusions you think are appropriate. Yes, I do. Now, I probably should have set the scene a little bit. What is she talking about when she says, or asks, do you think he could have been influenced to change his report? We're talking about the person tasked with investigating the sexual assault, the SANE examiner, sexual assault nurse examiner, which is a specialty sort of training program provided by the Kentucky Board of Nursing and presumably all across the country. Those nurses then do forensic examinations on the patients to collect evidence, photographs, things of that nature, right? And so what she's asking me is, do I think that the SANE nurse could have been influenced to change the report? Now, why would she even ask me that question? It's because I asked her, am I crazy? Do I not remember the conversation that I had with the SANE nurse correctly? And by that I mean he told me that there was evidence of sexual assault. Later I was told there was no evidence of sexual assault. Well, I'm not the only person that had that conversation. I had that conversation with the SANE nurse. The person in that audio recording had the very same conversation with the SANE nurse, the treating physicians, etc., etc. So what we're really wondering is what happened between the date that the assault was officially reported, the very same day that I talked to the same nurse and she talked to the same nurse, and 6 months later, when, or however many months later, when that employee was being placed back to work in patient care. What changed? Do you think it could have been influence to change the results of the report? Yes, I do. I felt that same pressure. She says it again.
The only thing I can figure out is that maybe he was influenced to change that report.
Yes, it's the only thing that makes sense, because otherwise nothing makes sense. Why would somebody come to me? First, I never really thought he should have divulged anything to me, and frankly, I kind of wish he hadn't, because I wouldn't be sitting here still struggling with this. Why would he tell me, administration, treating physicians, etc., that there was evidence of sexual assault, which resulted in specific treatments for that patient, and then later file a report that says something totally opposite to that. Nothing else makes sense other than undue influence. The question is then, who unduly influenced him to change a report? You had to listen.
You were not in the room when you spoke with HR. He called me in HR to his office. Remember, because when we raised that issue, he said he was in the call.
Mm-hmm.
And then he called me in to the office, and he said, well, we're going to go ahead and bring you back to work. And I said, well, what happened with him telling us that this other stuff? And he said, I guess it's he spoke to that they had legal had said this is what he put on his official report.
Right.
So we were going to use the official report.
Okay, so what she's saying here is that I kept raising questions, and apparently so did she, about the inconsistencies between what was originally reported when the sexual assault was investigated and months later when this gentleman was going to be placed back to work. What changed? She said she met with that individual, HR, and someone else. I can't remember exactly what she says, but she says something along the lines of she was told that they reviewed this with legal. Legal said that this is what he put on his official report, and so we were going to use his official report and therefore place him back to work with vulnerable patients. So I don't know who made what decisions, when those decisions were made, or anything. I just know that eventually the gentleman was placed back to work with patients. But what I do know is that I reported my concerns to the legal department. They reported those same concerns to the legal department, and the legal department took a position that since there was one story put on the official report, that's what they were going to go with. Now, I don't know what's reasonable or not reasonable, but to me, reasonable would be to say, hold on a second. Before we put him back to work, maybe we should pick up the phone and call some of the people who were directly involved in the investigation. Because I can tell you that nobody referenced in that clip actually talked to the patient, or at least I don't believe that they did. I mean, I was there the whole day. I talked to the patient. She was there on the floor that day, and neither she nor I were consulted officially in terms of those issues. Yes, I did officially report the incident up the chain of command, but then it was turned over to others and it went haywire from there. But you have to ask yourself, wouldn't a reasonable legal department say, hold your horses, right? Because they've now concluded this guy's good to go back to work, right? What standard are they using? Now, I don't expect them to use the standard in a criminal trial, beyond a reasonable doubt. I don't even know that I expect them to use a lower standard, preponderance of the evidence. But when you're talking about an alleged sexual assault and questions about whether there is inconsistent evidence, possible cover-up, etc., maybe a reasonable legal department would say it's probably not a good idea to let that individual come back to work for Norton Healthcare. And yet that's what they did. Like I said in a legal department, in an earlier video, the only reason they ultimately terminated him, at least what I was told, was that while he was on leave, he was accused of doing the same thing at another healthcare facility. So, you have to really ask yourself if somebody should clean house over at that legal department, and for that matter, at the system HR department, which is where I initially brought my concerns. I beeped out names there because frankly, I think there are innocent people involved in that conversation. And is it the habit of Norton Healthcare to fire people when they think they're going to be a problem? I don't want anybody being fired that didn't have anything to do with those decisions. So again, I bleeped out some names. So at some point, I think I mentioned in another post that I was persona non grata in the legal department. I was very consciously aware that people were upset with me.
Do you, maybe you're misperceiving why they're upset? Maybe they're upset because you're continuing to pursue that difference in what he told us and what was in the report.
Well, and that could be, I don't know, that could be. I just didn't want there to be any.
Maybe I'm misperceiving why they're upset. Maybe because I keep pushing this issue, raising questions which I think are fair and right. Maybe I'm misperceiving why they're upset. I'll be honest with you. No, I wasn't misperceiving. I knew exactly why they were upset. I knew that I was putting myself at risk. And frankly, I don't regret that for even a moment. They knew why I was having an issue with the way it was being conducted. I just don't know their motivation, why they choose to do what they chose to do.
Well, I think that's what it might be. I think we might be trying to keep Norton Healthcare out of trouble.
They might be trying to keep Norton Healthcare out of trouble. Is that their motivation? Probably. I can't play that game though. At a certain point, you have to stand up and do the right thing. Maybe I was misperceiving why they were upset, but I know that I knew why I was upset. If that were my family member, if that were my friend, or if that were a stranger on the street, I wouldn't want happening to them. I wouldn't want that to happen to them, frankly. I just wouldn't. I wouldn't. And I don't know how anybody could look the other way when somebody accuses an employee of that activity. So give it some thought. Next time you're choosing where to bring your family member, recommend to a friend, think about who's making those decisions.